for urinary retention, single center, real world experience, could be presented by Mohammed Nuruddin.
Okay, good morning, everyone. This is Mohammed Nuruddin. I'm one of the urologists in Hampshire hospitals, and I will present the data of the REZUM treatment in the urinary retention cases caused by BPH after 2 talks of UroLift, so I have a big view here. So as we know, REZUM has shown some effectiveness in the management of the latch caused by BPH in the last few years, but the potential space of the minimal invasive therapies in general in the treatment of the retention cases is not so clear to now. So the aim of this study was to assess the effectiveness of the REZUM in managing this group of patients. So over a period of 4 years, we have managed to treat 48 patients with urinary retention using REZUM. All of them had a follow-up in 3, 6, 12 months with the IPSS and the flow rate. The 48 patients, 34 of them had an indwelling urethral catheter, and the rest were using intermittent self-catheterization. Almost 50% of them had the procedure under general anesthetic, and the other half had it under local anesthetic with sedation. We used an average of 9 treatments of REZUM, 2 for the median loop and 7 in average for the lateral loops. Almost 82% of the patients managed to get rid of their catheter within 2 to 6 weeks after the procedure. 6% of them were kept in the intermittent self-catheterization, and the rest were kept with an indwelling catheter. There was a really good improvement in the flow rate, starting with a catheter and ending with 15 ml per second in 12 months. And then there was dramatic improvement also in the symptom score, dropping from 22 to 5 in average. And this is one of the cystostopic images of one of the patients, and this after 6 months showing a good cavity for the prostate. So I would say these results are encouraging, having an 82% chance to get rid of the catheter within 6 weeks after the procedure. It's definitely, we will need a longer and bigger group to assess that in much better way. But I would say the addition of the minimal invasive therapies in general for the retention patient may be a safe alternative for this group of patients, and also may help in the national waiting list for the time being. That's everything. Thank you. Any questions?
يبدأوا يسألوا بقى.
Thank you, Peter Ashley Southend. We're well presented. It's nice, but what's driving this? Why, when we have operations that get better success rate, is this driven by waiting lists like you just mentioned, or is it for the patient's benefit? Why are you doing it?
It's multifactorial. So we have REZUM in our center. We have TURP and we have green light vaporization. This is the option that we offer for our patient is prostate embolization. So usually when we see them in the clinic, we give them the option. We speak to them the difference, the side effects, the outcomes after that, and we go with their choices. So this patient was not like a randomized, or like was like how they selected for the treatment. So that's what they are opted for.
Can I just ask about the morbidity? You haven't really kind of mentioned sort of readmissions and infection rates and that sort of thing. And so I'd like to know about that, and B, a little bit about the average length of catheter duration. So you said up to 6 weeks, and I've seen people presenting at the AUA before about REZUM for retention, where the average catheter dwell time afterwards is 31 days or something. So what's the morbidity? If the catheter has to be in for that long afterwards, why not do something else where the catheter can come out the next day?
So for the morbidity in this cohort of patients, we have 2 patients. One of them presented with a hematuria that needed admission, 3-way irrigation, and the other one presented with UTI managed with antibiotic. For the catheter time, that's a collective figure. So we usually try in 1 to 2 weeks, according to the amount of the steam that we have injected to TWAC them. And 63% of them managed to pass the TWAC in the first time. Then if they failed,